We welcome this evening Dr. Alan Peterson. Thank you for coming, Dr. Peterson.
You're welcome.
Dr. Peterson, MD, is the Emeritus Director of Environment and Community Health at Lancaster General Hospital and Health in Lancaster. He is a native of Brockton, Mass, for you other native New Englanders, and came to Lancaster for his residency in family medicine. Alan has provided many years of public service, serving on the board of the Lancaster Conservancy. He remains on the Lancaster County Immunization Council and the Lead Coalition. He remains very active, writing for those organizations and the Lancaster Medical Heritage Museum. He is a husband, father, and grandfather, and these relationships help fuel his continuing passion to educate all about the climate challenges of climate change and the environmental degradation that has taken place in the recent decades, as he gives presentations throughout the region and the state. Dr. Peterson, the floor is yours for our talk on climate and change and health.
Thank you very much. I appreciate that, Michael, and thank you, Doug, for your help too. We'll just get right into this here. I'm going to share my screen and we'll get started. So here we are, and people say, gee, you know, you worked a long life in medicine, and why don't you just take it easy now that you're, quote, retired? I've been doing these talks now for about 8 years, and these are 3 of the reasons that I've been doing them. This is my daughter, Kirsten, my 2 granddaughters at one of the Lancaster County preserves, Climbers Run in southern Lancaster County. If we don't make some changes within the next 10 years, their lives will not be anything like my life and your lives have been concerning climate. As a matter of fact, I just found this earlier today. Let me find it. Kids aged 10 years of age today will experience 4 to 5 times as many extreme weather events as their present parents have during their lifetime. So, and I was supposed to have a picture in here too of my grandson, who I just met last week from Bend, Oregon, and that didn't come through. But anyway, these are the reasons that I really think it's important to think forward for our future generations. And these are the basics. Damage is real. It's happening now. Most of it's from greenhouse gases like CO2, which gets trapped in the atmosphere, and that's altering the Earth's climate. I say that it does pose a catastrophic threat to the planet and human health, but with a concerted, quick action now, we can create healthy and safe communities for our families and our children with major co-benefits, including improved air quality. And for those of you who didn't see it, the American Lung Association came out today with the state of the air for this year's, and it shows how much pollution we have in our atmosphere, but also better physical and mental health too, as we address these climate change issues. I could spend 2 hours just on this slide, but Michael wouldn't allow me to do that. The climate drivers you can see at the front, at the top here: increased temperatures, precipitation extremes, extreme weather events, sea level rise. That can create environmental and institutional issues, social and behavioral issues, leads through exposure pathways, and down to health outcomes, which you'll hear more from me about. Heat-related illness, and I don't know if you watched WGAL, but they had a comment tonight on WGAL about heat-related illness. I almost dropped off the couch when I was listening to that, but I was glad to hear it. And I think tomorrow night I think they said starting at 7, they're going to have a special on that issue. So that might be something you might want to look at. Also, cardiopulmonary illness. It's not just lungs that are affected, but the heart and blood vessel systems too. Food, water, and vector-borne disease, and mental health consequences and stress. We don't hear too much about this because this usually happens after the breaking news on the TV and so forth. Sometimes it's weeks later, but it can be quite significant. Couple things here. Weather is short-term changes. Climate is the average weather over 30 or more years. Some people say 20 to 30, but that's a definite difference in definition. I threw this in here for one main reason. These two slides were taken in the Uppsala Glacier in Patagonia in the Southern Hemisphere, both in the same season, so it's not fake news. This one's from 1928. You can see this is all ice. 2004, the only ice is in what's left of the glaciers at the top of the mountains. This isn't just happening in Patagonia. This is happening worldwide. Climate change may already be hurting your patients. American Thoracic Society, 77% of respondents believe increases in the severity of chronic illness resulting from increased air pollution as a consequence of climate change. American Academy of Allergy, Asthma, and Immunology, 63% indicated that their own patients had increased allergic symptoms. By the way, by 2050, not too far away, the research is predicting that 50% of us will have listed on our problem list in our doctor's offices seasonal allergies, just because the growing season is getting that much longer. We have increased the growing season in our area rather, by about 3 weeks just in the last 30 years. So this is a significant change. 61% of the members of the National Medical Association indicated that their own patients were already being harmed a great deal or moderately by climate change. I make an analogy with secondhand smoke. Back in the days when you remembered Ronald Reagan and John Wayne doing commercials for cigarettes, we really didn't know at that time all of the problems with tobacco and smoking. But now we realize you don't even have to be the smoker. You can just be the person breathing in the room where the smoker is, and it can cause developmental effects, respiratory effects, cancer effects, and heart and blood vessel effects. Climate change is going on to cause all of these problems also. Greenhouse gas. Believe it or not, water vapor is the most common greenhouse gas. It doesn't cause problems. It's made from the problems with the greenhouse gas effect. Human activity indirectly intensifies water vapor quantities through global warming because a warmer atmosphere contains more water vapor. Very important. A warmer atmosphere contains more water vapor. Carbon dioxide, we'll be talking a lot about that tonight from the fossil fuels. Methane, which is natural gas from agriculture, from fracking, etc. Nitrous oxides can originate from fertilizer use, industrial processes, vehicle emissions, etc. Ground level ozone, carbon monoxide, hydrocarbons, and nitrogen oxide can chemically react with UV light in the hot days of the summer and cause ozone, O3, and on and on. So there's lots of greenhouse gases, but the biggie that's causing most of the problem right now, big two, I should say, are methane and carbon dioxide. This is a study that was done 2013, over 2,000 peer-reviewed climate articles, peer-reviewed. So these are climate scientists. by over 9,000 authors. This is supposed to be a pie chart. This is the one author right here who rejected man-made global warming. So the scientists are in agreement. Where does the global warming go? This is important. It ends up in the ocean, over 93% of it. And we'll talk about this a little bit more in the future here too. Couple things on methane. Again, this is natural gas. We can prevent 100 billion cubic feet of methane leaks every year just by being careful with how we get the methane out of the ground. In other words, a lot of it is burned off afterwards. A lot of it leaks out. That's more than enough gas to cook a meal for every man, woman, and child on the planet every year. I pick on Massachusetts and Boston because that's the area I grew up and had my education in. Every circle on this map of Boston is an area where the infrastructure is so old that there are leaks that can be measured of methane, natural gas, from a vehicle standing on top of the asphalt and on top of the pipelines. It's amazing to me that we don't have more explosions than we do. And multiply this by the hundreds and thousands of old cities in the world who have the same issue. So here we are, right here after the Industrial Revolution, as far as CO2 concentration, parts per million. Over 800,000 years, and we know that because of ice core data, we look back, none of them went above 300 parts per million. But here we are now, we're at about 418 parts per million now. Never happened before. And it's because of what we have done, we humans have done on the earth since the Industrial Revolution began. Global warming causes asthma. Communities with high ozone concentrations, so these are high temperature summer days, relative risk of developing asthma in children playing 3 or more outdoor sports is over 3 times that compared with children playing no sports, which we don't suggest, or playing sports inside. Asthma and respiratory diseases, 30 million Americans and 235 million worldwide with asthma. 200,000 deaths per year. 8 million deaths per year due to air pollution, etc. Respiratory disorders, including asthma and allergies, higher temperatures. I talked about the pollen load, increasing respiratory problems. But some people don't think about this. The heavy rainfall and flooding cause dampness in the homes, potentially leading to indoor mold and fungal growth associated with nasal and throat symptoms, coughing, wheezing, asthma, and other problems. Your local coal burning power plant has a new filter. His name is Danny. Right now in the United States, we have about 1 in 10 children with a diagnosis of asthma. This is terrible. Physician observations fit well with published literature. Children with asthma with more frequent symptoms, exacerbations due to poor air quality, inversions, high allergy counts, rental living accommodations with visual mold, or you just smell it, you can't see it sometimes. Living in areas with high winds, fires, all bad things. Pennsylvania air quality non-attainment areas. This is not part of the state of the air report that came out today, but it shows you the areas of particulates. This is soot, and ozone, which is smog. And you can see the southeast and the southwest parts of the state are hammered pretty hard by these issues. Particulates are measured in parts per million, 2.5. They can increase heart attacks, congestive heart failure, cardiovascular disease, deaths, increase insulin resistance, diabetes prevalence and incidence, and the ozone, nitrous oxides combined can increase asthma and lots of the other things too. This just shows a high ozone day in New York City, and you can see those that are affected the most are the infants, children's, the elderly with chronic diseases, prenatals. This shows a healthy airway, pink, but good dilation. Inflamed airway, you can see how much redder it is here and more constricted from the ozone. Volatile organics, nitrous oxides, heat. Again, high summer day, you can see here 95. You can see it goes through the EPA standards fairly easily, and we're seeing many, many more of these hot days and will in the future. Cardiovascular issues, again, increased ozone due to the increasing temperature can affect the heart system, heart arrhythmias, atrial fibrillation, ventricular fibrillation, PVCs, heart attacks. A majority of Americans think carbon pollution from power plants is regulated. They're wrong. And I make an analogy here with what we were doing with sewers in the 1700s and early 1800s. You know, we were dumping it into our backyards and along the streets until we found out the health issues from doing that. It wasn't just the stink. It was the disease we were causing. Same thing with this today. Some people don't think Pennsylvania creates a big problem with emissions. This was just measured in 2016, but we're pretty much in the top 3 or 4 as far as million metric tons of carbon dioxide. Over 200 million metric tons of carbon dioxide we put up into the atmosphere each year just from the state of Pennsylvania. It can have impacts on agriculture, reducing crops. We'll talk about this a little bit more. Decreases photosynthesis, increases water demand, diseases, weeds. I threw this in here for one reason. This is it. Most people think one of anything is not very important. This is 1 degree centigrade, which is 1.8 degrees Fahrenheit. Grain yields decrease by 10% for every 1 degree centigrade increase in global average temperature. And of course, it's even worse as the temperature rises above that. And don't forget, depending on how much COVID or other pandemics we have in the next 30 or 40 years, we're supposed to have an increase of 2.5 billion people by 2050. So take that in mind. With decreased grain yields from climate change, we get big, big issues. Today, this is today, in sub-Saharan Africa, if you want water to drink, you send the girls down to the local watering pit. You don't care if this water is clean or not. You just hope there's water there. They go down in with their ladles. They fill the vases. That's their water for the day. By 2100, with business as usual, nearly a third of the world's land surface may be at risk for extreme drought. And right now, in the Southwest United States, the drought they're seeing now has not been seen in 1,200 years. So you don't have to go to the southern parts of Africa to see this. Some people say, well, I don't really care about that. All I care about is my backyard. I know you people are not like that, but some people are. Let's bring an example closer to home. Combined sewer overflow. What does that mean? Pennsylvania is the #1 state in the country for combined sewer overflow systems. What does that mean? When this was set up, either in the early or a little bit later 1900s, the sewers, of course, were collected, septic systems, etc. And the stormwater sewers from the streets were collected. Well, what happens when you have 3 inches in an hour or two? It has to overflow. And that still happens today, whether it's the Susquehanna, whether it's the Conestoga, whether in Pittsburgh it's the Allegheny. And I don't have to tell you what happens to these folks if they're swimming in there that day or a few days later. But think about where this water goes downstream onto a farmer's field, and then you eat some of that produce later. Not good things. And it would take billions upon billions. Again, multiply this by all the combined sewer overflows in all of the older cities in the world, and you can see the issue here. Heat in children. Emergency room visits increased by 133% just between 97 and 06. Half of these were children and adolescents. A lot of people don't understand, even resident physicians that I trained for years. Young children are not like adults. Their bodies are completely different. They're growing. They don't regulate their body temperatures like adults do, and they spend much more time outdoors. Heat illnesses are a leading cause of death and disability in young athletes. Every year, some 9,000 high school athletes are treated for heat-related illnesses. You don't hear about any of these. Young men make up a third of all heat-related emergency room visits in the US, and football players may feel the most heat. They are 11 times more likely to suffer exertional heat illnesses than players of all other high school sports combined. 2003 European Heatwave. Unless you had relatives there or you were there, you probably don't know about this. They had an estimated 70,000 excess deaths that year just from the heat, because this part of the world is not like our part of the world. They don't have a lot of air conditioning. Unless you can afford a very expensive hotel, you have to find a cave or a cellar to hide in, literally. Again, the elderly, the chronically ill, the little children, the prenatal patients, these are the folks that really suffer from this the most. Last year, they had another heat wave. They didn't have as many deaths. But according to this climate expert, Dr. Stott, if greenhouse gas emissions continue to increase, by the 2040s, more than half of the European summers will be hotter than the summer of 2003 that I just showed you. And by the end of the century, a summer as hot as that of 2003 will be considered unusually cool. Heat-related disorders. Some of you have had experiences with heat rashes, heat cramps, hopefully fewer with heat exhaustion and heat stroke. Again, those that are affected the most are those we've already mentioned, including those in poverty, no air conditioning, or urban area dwellers because of all the asphalt and the tile roofs and so forth, which just keep the heat closer to the ground. And that makes that a lot more of a risk. Diabetes. Diabetics don't do well in the heat. I didn't realize this till I was doing research on these talks, but many medications used to treat a variety of mental health disorders interfere with temperature regulation and heat elimination and may directly induce hyperthermia, high temperatures. How do I know that the West burn season has grown 50% longer in the last 40 years? This is my son, Drew Peterson, who just brought his son to me to see last week. These are some of the forest fires that he has fought in as a U.S. forestry ranger in Oregon. I want to point out these gray structures that are still standing. These are dead trees, dead from the pine beetle that is moving up the coast, partially due to climate change. And of course, they're not getting the snowpack in the mountains in the wintertime, coming down, providing more moisture and water to kill the forest fires with. So all you need is a dumb camper or a lightning strike. And here's all these dead trees just waiting to start another forest fire. Deforestation, and that's not just from forest fires, by the way, but you look at what they're doing, for example, in Brazil and Indonesia and Argentina, getting rid of the forests for profit or for growing rice, etc. Deforestation is responsible for about 15% of greenhouse gases. That's more than the total amount emitted by all cars, trucks, buses, and planes on the planet. So, again, a warming planet, the increased frequency and severity of extreme weather events. As ocean temperatures increase, they evaporate more moisture into the sky. Remember what I said earlier. Warmer air can also hold a lot more water vapor. So we get more and bigger storms and more extreme weather. And I know just in my lifetime, I'm 75 years old, I can attest to this, that I've seen this changing in my life. 80,000 acres of wetlands are lost each year in the US to intensifying coastal storms and sea level rise. What happens when you lose these protective coastal areas? Those storm surges can just rise all the further, and Louisiana, for example, and New Jersey know what's happened with hurricanes in the last 10 years. This is what I was mentioning earlier. We don't hear a lot about this type of problem on the breaking news, because this happens weeks to sometimes months later, but usually days to weeks, I guess. This is black mold. This is a photomicrograph of black mold. I majored in biology. I think this is a beautiful picture, but if this gets into your lungs, it can kill you. And that's what's growing literally throughout this house. You can see here, the water level was up to about here. My sister-in-law lived on the coast of New Jersey during Hurricane Sandy. She had water in her living room up this high. This isn't just on the inside. This is all through the walls, etc. I'm sure this was taken just for the picture, but this house most likely had to be torn down. So what happens if you don't have insurance? You don't have money to rebuild? Talk about psychological effects. You don't have to be in a war to get post-traumatic stress disorder. This can do it right here. I believe Dr. Peterson mentioned this a couple of weeks ago, but I'll concentrate on it a little bit again. Since 1850, all that dissolved carbon dioxide that's been going into the ocean that I told you about is decreasing the pH of the water. That means the waters, ocean waters, are becoming more acidic. I think there's a few of you in the crowd that like things like scallops, clams, oysters. Most of you probably like some of those. The shells are not forming as well, and they won't as this continues to increase in time. And again, another thing that I didn't realize until I was doing research on this, 50% of the medical breakthroughs that your doctor's office is treating you with, or the hospital is treating you with, comes from something that has grown or is growing in the ocean. And we know that a lot of the coral reefs, for example, are being threatened now, and all of the plants and animals that grow on them. So, and it's not just in Australia, it's all over the world where there's coral reefs. Vector-borne disease, what are we talking about here? Warmer temperatures, more precipitation, more humidity, and here we go. Here's your tick. Even this little guy right here, this larval stage, can cause Lyme disease. We have trouble seeing these when they're on our bodies, especially if they're under our arms or between our legs or whatever. And then we get sick. Here you can see a nice, fully vetted mosquito with an abdomen full of blood after he's just bitten someone. Buzzkill, this is from Hartford, Connecticut, but this is just an example. Between 1980 and 2014, there have been 37 more mosquito days. So again, it's not just the pollen that's increasing, But everything that likes a growing season, a longer growing season, and a more sedate, if you will, winter season makes these things worse. Lyme disease, here's an adult deer tick. Just from 2001 to 2014, this is the spread of Lyme disease over that time. You can see the Midwest, Northeast become much more polluted, if you will, with the disease. Every county now, each dot here is a confirmed case, by the way. Every county now in Pennsylvania has reported Lyme disease, and it's only getting worse. Dengue fever, otherwise known as bone break fever from the Caribbean, and Zika disease. Of course, we're starting to see some of this now in southern Florida and southern Texas. But I just want to warn you, if you live long enough, and I don't know when it will be, but you can see where we are here in Pennsylvania. Anything that's in blue or red right now has species of mosquitoes that can carry dengue fever. All that has to do is, like the pine beetle in the West, rise up the coast, and you can be sitting on your veranda without screens, and you will be able to get dengue fever or Zika disease in the future, because we have the mosquitoes right here that can bite you and give it to you. And here's some of the Zika species. And again, they're already here, the mosquitoes that can carry Zika. Community health, I just want to mention, and I know you've seen this from some of the horrendous typhoons and hurricanes in the past, increased interpersonal aggression, crime, social instability, decreased community cohesion. And I just want to mention one thing with Syria. Syria, big country, clan here, hundreds of miles from each other. That way, because they had some differences in either their religion or some of their cults, whatever. Now, decades of drought. You can either stay there and die, or you can move to the city. And what happens when you move to the city with those different feelings and thoughts? Strife, civil war. Then what happens? Immigration. That's just one example, and it's going to be replicated over and over again. Persons with disabilities often rely on medical equipment, such as portable oxygen that requires an uninterrupted source of electricity. Average winter temperatures, here we are, southeastern Pennsylvania, Massachusetts, Oregon, northern parts. Degrees Fahrenheit, trends per century. In the last 100 years, 3 to 6 degrees increase in everything that's dark red here. You go down here to the south, they don't know what you're talking about because they haven't seen that winter temperature increase. So you know what the answers are here. Renewable energy, alternative energy, solar, wind, etc. We need to stop externalizing health and climate costs of carbon. If this is fossil fuels, you can see he's about 2 feet taller than this guy. He's renewable energy. We need to stop giving the subsidies to the fossil fuels and start helping out the renewable products. Even some of the Reaganites, if you will, and I think some of you are old enough to remember some of these names, Henry Paulson, James Baker, George Shultz, some of these folks are still alive. They even agree that the carbon dividend or carbon tax is something that will promote our economy, reduce regulation, shrink government, and promote national security. World energy use today, 16 trillion watts, 16 terawatts. This is what the world is using in energy each year. This is what we could get just from solar alone. And this is not a solar panel on every roof in the world, just where it's reasonable. Wind alone could give us much more than we're using today. Geothermal, hydro, ocean energy, etc. Intergovernmental Panel on Climate Change. Again, Dr. Peterman mentioned this, but if we don't make changes today, this is what's going to happen with our temperatures. Increased by 5 degrees centigrade. That is about 9 degrees Fahrenheit. By 2100, that's what the increase in average global temperature will be if we don't make some significant changes soon. The world will not be as it is today in any means. So we need to try to keep it below 2 degrees centigrade. And I want you to watch this. This is essentially my last slide here. It's a video. I want you to watch it. I want you to watch the northern part of North America. Don't watch the dates because it goes by pretty fast. I'll tell you what the dates are. You just keep an eye on what's happening here in North America. And this starts from about 1880 or so. 1890. 1900. 1910. 1920. 1930, 1940, 1950, 1960, 1970, not too bad so far, but watch, 1980, 1990, 2000, and 2011, 2013. I think you had some idea there of how the Earth, and especially our North America, is warming up. I'm going to stop sharing here, and I'm going to open it up to questions. You do have in your chat, I believe, my 2 handouts, Climate Change and Health in Pennsylvania. Again, for those who basically want to know what's going on outside their homes, and Personal Solutions to Climate Change. And in the top right of that, you can see my email there. Any of you who know a group that wants to hear me in the future, I don't charge anything. I can make it anywhere from 20 minutes to an hour and a half. And I'm very happy to speak to as many groups as I can out there. So I'll open this up to questions now. And if you don't have any, I have a lot more that I can share with you.
Thank you, Dr. Peterson. We do have a couple questions in the chat so far. Just as a repeat, and you, if you want to raise your hand, I'll ask that you keep your hand up or use the icon and the reactions icon that flashes away. So you might have to repeat that for me to make sure that everyone has a chance to ask questions. But I have a couple of questions. One is a personal question, and Karen, I guess if you want to raise your hand to speak yourself, but otherwise I'll pass along your questions. One is that we had one of our participants that spent most of her adult life in Baltimore and then has moved up to Pennsylvania in the last 10, 15 years. And she developed asthma in Baltimore in her 60s, and then in the last, like I said, 15 years, it's gotten worse. Would you? I mean, based on, I guess, the geographical pieces you've shared with us, would you guess that might be related to climate change?
Yes. Again, in the last 30 years, the growing season has increased by about 3 weeks. So that increases pollen significantly. So yes, that very much may have had something to do with it.
The other question is a little more of a global question, and maybe this is outside of your bailiwick, but can you explain a little more of the carbon tax? And of course, you noted in your you noted in your presentation that a lot of carbon pollution, for instance, isn't regulated as it needs to be. But can you talk about how the carbon tax is related to some of the issues you presented on carbon?
Yes, whoever asked that is a straight man for me because I had this ready. I'm just kidding. I don't know who asked the question. But the Energy Innovation and Carbon Dividend Act. I'm actually a member of the Citizens Climate Lobby here in Lancaster. And this again, you saw my slide on the conservatives that even agree. Those conservatives that were listed at least agree with this. But this would put a price on fossil fuels extracted from the ground or imported to the U.S. from some other country. This money then comes back to every American of all ages to help pay for our daily costs, increase the market-driven economy, creating 2.1 estimated million new jobs, decreasing emissions, again, from the fossil fuels, by at least 40% in the first 12 years, and improve our health. I don't have to say anything more about that tonight, I don't think, by saving lives and reducing pollution. Because it comes back to us, it is therefore a dividend and not a tax on fossil fuels. 57 nations around the earth have implemented or scheduled implementation by 2019. The Intergovernmental Panel on Climate Change, again, the IPCC, praises the importance of carbon pricing as a crucial tool in any cost-effective climate change mitigation strategy, and it provides a mechanism for linking climate action to economic development, and it can stimulate the innovation of new clean technologies. So that's my summary, as I know it anyway, concerning that.
Thank you.
You're welcome.
There's a, okay, let me go back here. Okay, yes, there's been studies and or articles about the decrease in human fertility, male and female. Can you speak to that a little bit regarding the climate change and how that may be bringing that about?
Yeah, again, pollution affects many parts of the body. It's not just the heart and the lungs. And the particles, for example, let's just talk about the soot for a second. They get through the lungs, end up in the bloodstream, and they can go to every organ in the body. So these can have dramatic effects in all of these. And I just want to, as an aside, I just want to say, even COVID has been shown just within the last month or two to affect sperm counts in males. So if I were back in practice now, I would say to the men who say, I don't want to get that stupid immunization, I would say, well, and especially if they're in the procreation age, I'd say, you know, if you want to keep your sperm healthy, you might want to think about it. And we'll be open tomorrow if you want to come back. Okay.
I'm just going to interrupt with a comment regarding the handouts. There was a concern, apparently they weren't accessible. They are in the chat, should be available if you look in your chat, and maybe you need to go, and Doug, if you're still on the line, you can correct me, but handouts are at the beginning of the chat. Okay, so the idea is to go back through there. There was some question, Dr. Peterson, about going through a little bit more on the personal elements of things we can do on a personal level. But let me ask a couple other questions, and then maybe if that seems feasible at your end, we could talk a little bit about that handout. That might highlight things that we can address on a more personal level. But can you talk a little bit? Methane, of course, has been described as the chief negative agent in terms of having our climate warm more quickly than otherwise. And you mentioned a lot of methane leaking. Can you talk a little bit more about that? I mean, I guess it comes out as terms of the fracking in Pennsylvania, but can you expand a little bit more on where the methane comes and I mean, I guess what preventative things people should consider?
Sure. Well, again, I mentioned the infrastructure pipes in the older cities that are just leaking just about everywhere. I didn't mention the permafrost, but the permafrost is a big exuder of methane. And the Arctic and the Antarctic, of course, are melting. And in the Arctic, of course, there's tremendous amount of permafrost. So this is going to really increase our methane problems. Yeah, and the way that the fracking is done, and I'm not in the fracking business, obviously, but if it was just more concentrated on preventing the leaks from the fracking units themselves, that would be a tremendous bonus, not only to the corporations who make money on it, but to our climate also. So there are lots of things with methane. Methane, by the way, a lot of people don't realize this. Methane, again, natural gas, has 86 times the greenhouse gas potential of carbon dioxide from coal. So when you compare it to coal in the first 20 years, so it's 86 times worse, if you will, as far as greenhouse gas potential in that first 20 years. And that, of course, increases more global warming. Did I answer everything there, Michael?
I think so.
Okay.
I mean, it's a lot to take in, and it's, you know, the idea is to keep coming back.
Right. If you don't have any other questions, I want to read this from Dr. Catherine Hayhoe. She is an atmospheric scientist at Texas Tech University. If you've been involved at all in climate, you know her name. And this was given at a Appalachia Regional Conference, Citizens Climate Lobby in 2021. She says, the best way to inspire people to care about and take action on climate change is through a grassroots movement. Talk to people. Have conversations. Dr. Hayhoe cited a man in England who, after one of her lectures, went back to his hometown of over 300,000 people and was able to report back to her on the 10,000 conversations his initial conversation sparked. I think that's just amazing. Two key themes. First, people tend not to be concerned about climate change because they believe it does not affect them. It affects people in distant lands, and it's not a present threat to them. Second, climate change does not belong on a list of priorities because it affects every priority: racial equality, mental and physical health, our families and friends, children and young people around the world, all living creatures, decisions about where to live, what to buy, what to eat, our water, the future, etc. Number two, climate change is integral to every aspect of our lives. These two themes mean that we need to make climate change relevant to people's lives, how it affects each of us here and now. Says Dr. Hayhoe, bring it close, bring it here, bring it now. Dr. Hayhoe stressed the need to be hopeful ourselves and in our conversations, scaring people, and I hope I didn't do that too much tonight, scaring people with doomsday data and or speculations and making them feel guilty are not motivators. People need to feel empowered. Conversations ought to include suggestions for concrete and doable actions. And that's one of my handouts that you have. We care because of who we are, e.g., person of faith, person of color, grandfather, birder, B-I-R-D-E-R, architect, etc. were a few of the responses to her question, who are you? So I thought that was very enlightening to me, and I usually try to share that with the groups that I talk to also.
Well, I think you were an apostle before she was trying to select apostles, but anyway. So we've got a couple of questions or comments that relate to your handout regarding personal changes. Would
Yep.
you be willing, I'm not sure we have the time either, but would you be willing to choose what you would select as your top 2 or 3 on that list and talk about them, maybe read through them?
Well, I think number one is just what Dr. Hayhoe said, get involved. And you people probably are somewhat involved, or you wouldn't be listening to 3 of these. I don't know if you've listened to all 3, but anyway, get involved, let your voice be heard, bring up climate change when you can in daily meetings. So today, I was at the doctor's office, and we got talking about the rainfall, the increasing rain. And I just happened to mention how this is really increasing significantly over the last 50 years in Pennsylvania due to what we're seeing in climate change. And the nurse sort of shook her head and agreed. But that's just an example. Try to bring it up when you can see it fit to do so. If you can, change your electric provider. You can go on the web. I have PP&L. You can spend literally 5 minutes on there, and you can choose a source that is either solar or wind. It still comes through your bill, but they contract with these renewable folks. You might pay a little bit more, but hopefully you'll sleep a little bit better because you'll know that you're really helping out climate. The car you drive is important. You don't have to buy a Tesla. I just saw a letter to the editor today in the Lancaster paper. Somebody was negating electric vehicles. I have a used hybrid, and it didn't cost me all that much compared to a Tesla. But over the lifetime that you own an electric vehicle, it's cheaper in the long run. First of all, you're not buying gas, or at least as much if you got a hybrid. And all of the equipment in the car lasts so much longer. It doesn't have to be replaced, etc. So it's a lot cheaper in the lifetime that you have the car to have an EV, and you're doing so much for the climate. I just plug mine into a regular outlet in my house, and within 5 hours, it's completely charged. So again, making your house airtight, that stands for reasons, I guess. Investing, look where you're putting your money. Very important today. My old alma mater, Boston University, just said, okay, we're not going to put any new money in it. And I said, well, how long is it going to take you to get out of the old money? Well, about 10 years. And I wrote to the president of BU, actually, and I said, this is not acceptable. It shouldn't take you 10 years to get rid of your old fossil fuel investments. But anyway, they're not putting any new money into it. Programmable thermostats, you obviously have to use them if you're going to have one in the house. We talked about revenue neutral fee from the government. Eat less meat. Hey, right up doctor's alley. It's better for you if you're eating vegetables and fruits anyway. And beef, when you think about all the things that beef does in making climate worse, it's really incredible. So do positive things for your health and for the climate. Get off the beef, get off the meat as much as you can. Power strips, again, you have to shut them off when you're not using them. Upgrade your appliances. Very important to do that. And
Dr. Peterson, I'm going to jump in since the attachments are available, and you know, by highlighting the ones that you've highlighted, it focuses us on the priorities. There are a couple of specific questions that are medically related. And one of these might be repeating, if you'll permit me, one of these might be repeating something we've been talking about. But, I guess the studies have been that sperm count in men goes down, is going down related to climate issues and areas of more extreme pollution. How about sterility for women?
That's being affected somewhat also. So again, the eggs and the ovary, they all have to be affected by what's coming in with the blood supply. So whether it's your testicles, whether it's your ovaries, your uterus, etc., all of these things can be affected. So yeah, it's an overall picture.
And this is maybe, thank you. And this is maybe, and this probably needs to be the last question. But there's a question regarding a plant-based diet. As we you just spoke to the eating beef and how much energy and perhaps methane is released from that. Would you confirm that a plant-based diet is less negative for the environment?
Absolutely, no question about it.
And again, you're not a dietitian, but my understanding is there are a couple of things that you have to be a little cautious about if you go fairly plant-based in terms of maybe one of the vitamin Bs and whatever to make sure you maintain your own health.
Well, again, the more diverse you can be, the better. EWG just came out with their study that was showing that kale and strawberries don't look good as far as pesticides are concerned. So you probably want, if you can afford it, you probably want to go as much organic as you can for your health.
With that, and I apologize if I missed any raised hands in the chat. I was trying to scan and people were entering things. But otherwise, Dr. Peterson, thank you so much for joining us this evening. The handouts have been available. We heard your invitation for those of us that may be members of other groups. And I know that's how you and I got together originally. And you're very generous with your time. The information you shared with us has been very enlightening, and we're going to take it with us, and as we try and develop further actions within our congregation and our groups. So with that, how about a round of applause? And thank you for joining us again. And if audience members have follow-up concerns, perhaps you can send them to office at UUCY.org for the attention of the Green Action Team. And we'll try and follow through with that in terms of getting the information to you or questions to you and creating options for follow-up.
Okay, thank you very much again for inviting me. I appreciate you attending also.
Good.
Spread the word.
Yeah.
Spread the word out there. Spread the word.